Ms. Chair,
Yes.
whoever was doing recording, it's messing up my computer. They would turn it off and turn it back on. Thought you should know.
George, I have to record this meeting.
Okay.
Okay, I'm trying to figure out how many are back, if we still have our quorum and everything. And it looks like I do. Okay. Then we will go ahead and Jane Ellen, we're going to turn this over to you. And we're going to ask people when you have questions to raise your hand and wait to be called on. So go ahead, Jane Ellen.
Okay, and Heidi, my understanding is you're advancing slides?
Yes, I am.
Thank you. Okay. Hello, everybody. Jane Ellen Wydance, Deputy Director of Policy, Deputy Director of Policy for the Office of Aging and People with Disabilities. And I'm just going to do a high-level overview of Agency with Choice and then open it up for questions and feedback and anything that you guys want to discuss regarding that. I'm going to stay off camera because I don't want to lose stability in my Zoom thing. So next slide, please. So there is proposed legislation that's in development that would create a new option for individuals receiving in-home services called Agency with Choice. A lot of states have it. Oregon hasn't had it in their self-directed model, and that's what we're going to talk about today. Next slide, please. Oh, and I should say, I'm so sorry, I should have said this right up at the top. I want to thank the Oregon Home Care Commission for allowing me to speak today and to allowing us to invite others to participate in this discussion as well. We'll see how it goes, but thank you for the Oregon Home Care Commission Advisory Committee for letting us be here today. So what is an agency with choice? It's an alternative model to our current consumer employer program. The legislation would apply only to individuals who receive benefits through aging and people with disabilities and are currently served by home care workers. The previous draft, and I think the current draft would still limit whom we contract with to up to 2 agencies to provide this alternative model. It wouldn't replace the home care worker consumer employer model. It would be a new addition of how people could receive services. And the big difference here, and we'll go through a lot more specifics, is agencies would assume full employer responsibilities on behalf of the consumers. And what that means is they would be taking care of the background checks, they would be taking care of the payroll, they would be taking care of time off, they would be doing all of those things, including up to dismissing the individual from being a agency with choice provider. The difference is from right now we have 2 models, right? I'm leaving independent choices out for right now because that'll still be there. But basically in our 2 models that most consumers receive services through is that we have an in-home care agency and we have the consumer employer model. In a consumer employer model, the consumer is fully responsible for screening the individual, telling the case manager that this is the person that they want to provide their care, how many hours that they want that person to work, and that is that. And then the individual is enrolled with the Oregon Department of Human Services as a Medicaid home care worker. This would be changing because unlike an in-home care agency who sends people to the person's home, and the model of the agency with choice is the consumer still gets to choose who's coming to serve them, versus an in-home care agency that may send someone that's new to the individual and the individual's never met them. Next slide, please. So in the new model, what would happen is the agency with choice, this new entity, would do all the pre-employment screening, training, and recruitment. So taking a lot of that work off of individuals. The employer responsibilities, like I said, payroll, time off, benefits, workers' comp, hiring and dismissal. Now, I want to be clear there. That's working for the agency with choice, right? It's not working for the individual. The individual could still say, I really like this person and I want them, or I don't like this person and I don't want them to come back, or it's not working. Could you please get me somebody else? So the consumer still has that right in this new program, but dismissal as in this person's not meeting minimum expectations of an employee, basically they'd be able to get fired by the agency with choice. The agency with choice would also be doing regulatory oversight of workers, including investigations of abuse, workplace safety, and making sure that the worker is meeting the quality expectations in delivering services. The agency with choice would be responsible for training the direct care workers. They would also support consumers on how to manage their responsibilities, and they would ensure that backup providers are available similar to how in-home care agencies do it, but still with a strong voice from the consumer. Next slide, please. So just some comparisons of our existing system and roles and responsibilities, because I think people get confused about this a little bit. So within our current system, the Oregon Department of Human Services Office of Aging and People with Disabilities determines an individual's eligibility, assists the development of a service plan, and authorize services. They pay the home care worker on behalf of the consumer employer, including taking out taxes and all that good stuff. We enroll qualified individuals as Medicaid providers, i.e. they specifically home care workers in this example. We provide regulatory oversight of home care workers, so we can make them go to training, we can terminate their ability to be a home care worker, et cetera. That's within the Office of Aging and People with Disabilities. And then we pay the benefit trust on behalf of the home care workers. The Oregon Home Care Commission, on the other hand, sets training requirements, procedures, and certifications. They offer resources and consultation to help consumer employers to hire and manage their home care workers. And that's both on the front end of somebody becoming a new in-home consumer and if the consumer is facing concerns or problems. They provide a registry for employers to find qualified home care workers, and they act as the employer of record for collective bargaining. Next slide, please. The program, and I know you guys all know this, but just in case there's people who don't, is that the consumer employer program is a purely self-directed model. So the consumer receiving services is required to locate, screen, and hire a qualified home care worker. They notify the case manager which home care worker has been selected and how many hours that worker should receive. So let's pretend the person has 2 home care workers that they want to work with them, and they'll say, give this person 30 hours and give this person 30 hours, or give that person 40 hours, give that person 20 hours. They also then supervise and train the home care worker to meet their needs and how they want things done to meet those needs. They schedule the home care workers schedule. I want you here Monday, Wednesday, and Friday, or I want you here every day, et cetera, and what times they want. And they also schedule the time off that the individual will want to take. They also track hours to ensure the home care worker is not working more than the authorized hours. They recognize and attempt to correct any performance issues that you don't like how something's doing, or you don't like the way you're being treated. That's a consumer employer responsibility to address those issues. And they get to discharge an unsatisfactory home care worker. If things aren't working out and they don't want to keep that person, they have the full right to say, no, thank you anymore. I don't want you to come anymore. And then they also need to follow all employer responsibilities required by law to ensure that the workplace is safe from harassment. So they can't treat people disrespectfully, they can't harass people, they can't sexually abuse people. All of those protected classes and requirements in labor law in Oregon and nationally are required to be followed by the consumer employer. Next slide, please. So what's the difference between, and these are not pros and cons, folks, this is just the kind of the differences. So in our current program, in the Consumer Employer Program, the Oregon Home Care Commission provides, oops, next, back slide. Nope, you're going the wrong way. One more slide up, I think. Okay.
I'm sorry.
It's okay. The Oregon Home Care Commission provides a registry of home care workers to hire that are available to be hired. Consumer employers can hire a family member or a friend who meets qualifications as a home care worker, and they can help that home care worker connect with the local office to make sure that they follow the process to become a home care worker. In an agency with choice model, the agency will have caregivers from which the consumer can choose, but at the same time, the consumer can say, hey, I want my family member to work with your agency and I want them to be my caregiver. And as long as that individual still qualifies to be a Medicaid provider, they can be hired by the agency with choice and receive services. The hiring in the Consumer Employer Program, hiring directly enables consumers to select the workers that best meet their needs, including language spoken and the cultural preferences. In an agency with choice model, the agency would work with the individual and the caregivers that they have available to meet the needs of the individual. The consumer still has a role in selecting the caregiver, but the agency is primarily responsible for assigning a worker to the consumer. And then in a Consumer Employer Program, the consumer is responsible for finding replacement home care workers when they're needed. That could be the home care worker is sick or there's weather and they can't get out of their home to come to the consumer's home. It could be that the home care worker wants to take time off. All of those things are the consumer employer's responsibility to ensure that they find a replacement and have a backup plan. In an agency with choice model, the ideal way this is going to work is the agency will cover needed shifts and find replacements if a caregiver can't report to work. That will still require a discussion and cooperation and acknowledgement from the consumer, but the intent is really to cover needed shifts. And can you slide up just a little? Nope, not in the next slide. I can't read the bottom slide bullet on that. Under management, it's not showing in my slide.
So, if I try to go up, it moves me
Can
to
you,
the next page.
yeah.
It says for management, the consumer manages the home care worker. And with the agency manages the caregiver.
Thank you. And so what we're intending to say there is, again, those responsibilities that we listed above, and thank you, Heidi, that the responsibilities that we listed above is, that's what I mean by managing the home care worker, right? You're going to show up Monday, Wednesday, and Friday, and here's the tasks I want you to do. Here's how I want those tasks to be done. Oh, wait, you're not doing it quite the way I want you to do it. Please do it this way. It's that kind of discussion and managing the home care workers, both their schedule and what they're doing. In the agency with choice model, the consumer still manages some of those day-to-day tasks, but issues around discipline, adult protective services, around the quality of the care that is being provided is within the purview of the agency. Next slide, please. So again, in the Consumer Employer Program, the consumer employer and the home care worker can report grievances to the Oregon Home Care Commission. Consumers can provide feedback and request assistance from their case manager, but the relationship is really between the consumer and the home care worker. The home care worker can also report concerns directly to the local case manager or the local office for those issues to be addressed. And the APD and the AAAs, the area agencies on aging, provide additional oversight to ensure consumer employer needs are being met. So those are what we call our directs and our indirect contacts to make sure that the consumer needs are being met. In an agency with choice, the consumer is now working directly with an agency, and the caregiver is working with an agency. So if there are concerns or grievances arising, they'll be addressed through the agency with choice. The case manager is still there to help, and to provide additional assistance, and will be there to ensure the safety and well-being of the consumer. In timekeeping and payment for folks in the Consumer Employer Program, home care worker submits their time through the ODHS provider time capture system, and then ODHS reviews the hours, submits the hours for payment into our payment system, and then the check is issued directly to the home care worker. Check, I'm using the term check to also mean electronic deposits. In an agency with choice model, the agency handles all timekeeping and pays the caregivers directly. Next slide, please. So why is agency with choice being proposed? I think there's quite a few reasons, and I'm just summarizing some of them here. But there's a shortage of home care workers, meaning some consumers go without the supports they need. And that's a growing percentage of the people for whom APD should be serving. Used to be that we used to close people who didn't access paid supports in 30 days. Now we keep them open. And we are somewhere, give or take any time period, between 5,000 and 7,000 people who have not been able to access paid supports, that they've been determined eligible. That's not the group that are waiting for eligibility determinations. These people are eligible for services and they have been unable to find a caregiver to meet their needs. Additionally, on the home care worker side, home care workers are frustrated because the state enrollment process can take a long time. As an example, background checks, and they can be confusing for folks because do I need fingerprints? Do I not need fingerprints? How do I do that? It can be very confusing for folks. And then to be very blunt, our state payment systems are causing delays and errors. So people are receiving late payments and or partial payments for the work that they've performed. And then they also have expressed that there's a lack of support when issues arise with their consumer employers. If they feel that their consumer employer is abusing them or their consumer employer is living in an unsafe situation, they don't feel like they have a direct access to support those consumers and to address those concerns. And when we started looking at this in 2019, it's all a blur, folks, and anywhere between 2019 and 2021, APD actually looked at, is an agency with choice model something that works for older adults and people with disabilities? And what we found in that research is most states have an agency with choice, not most states that have an agency with choice model use this to provide services to individuals with intellectual and developmental disabilities. Fewer states are using this model for older adults and people with disabilities, but I also have to acknowledge that a lot of states do not have an in-home program that is as robust as Oregon, right? Oregon is really proud of the fact that we have about 55% of our consumers, a little less than that, but pretty close, 54 point something percent to 55% of our consumers are receiving in-home services. And most of them, the vast majority of those consumers, are receiving those services through a home care worker. So when we looked at this model, it seemed like maybe there's some benefit and maybe there's some, maybe not, but it's an interesting model to give people options. Now, when you look at our state to the north, Washington State has moved everyone into an agency with choice model. So every single person who wants to receive in-home services through a self-directed model receives those services through an agency with choice. They no longer have the standalone home care worker program. They are all added into the agency with choice. They still have in-home care agencies that are licensed and certified by the state. But if a person wants to self-direct their care and choose who's delivering those services, everyone is in an agency with choice model. Next slide, please. So old slide that says thank you for joining us, but I'll open it up for questions or comments, concerns, anything I can help address, I'd be happy to do so.
I have a quick question. Should we just jump in, or is there
I think we were supposed to raise our hands. Ruth, were you going to call on people?
Oh, I didn't know if you were. Okay,
I'll call on
Eliza.
people.
Okay, Eliza has her hand up. Go ahead.
Good afternoon. Thanks so much, Ruth. I just wanted to acknowledge we had many people join us after the presentation started. And so we will provide materials for anybody that joined us mid-presentation. And we also know that there was a small portion of time there where the ASL wasn't on the screen. And so we want to make sure you know we will provide the presentation materials to help with that as well. Thank you.
Okay, Shelley.
Yes, I'm with the union, SEIU 503. How is this all going to affect union? Our union?
The agency with choice model is actually being proposed by legislators that have been working with SEIU. The intent is that the agency, Oregon Department of Human Services, would contract with these agency with choice that are willing to abide by collective bargaining. So the workers would get to determine which union they want to select and would be able to organize and join that union. So that's in the statute, but it's not intended to replace entirely the relationship that the Oregon Home Care Commission has with SEIU as the collective bargaining body.
Entirely. And so it does seem like there will be a slight effect on that. And when you say which union, do you mean like in various different states, whatever union you want to?
Well, some states don't require that their agency with choice have a collective bargaining agreement.
Okay.
In the statute or the proposed statute for Oregon, the original bill would have required that the agency that we would contract with would agree to allow collective bargaining. They had to front end agree to that, or they couldn't get the contract with us. But that doesn't mean that they would select SEIU, right? Because that's a membership issue. The members would get to decide if they wanted some other union.
Okay, I have another question. I hope. I am still a little, so we can stick with the OHCC program. If you are if you're a home care worker, you can work through that system or the agency system, right?
Or both.
Or both. Okay.
And the consumer could do that as well, right? So I don't know why, but the consumer could say, just like today, we have some people who have some of their services delivered through an in-home care agency and other parts of their services or their hours through a home care worker. The same would be true in the new model.
Yeah, depending on the availability of care workers, I guess.
Yeah.
Okay. Thank you. I appreciate it.
Okay. When I call on you, please tell us who you are. So the next one is Joy.
Hi, I'm Joy Vager. I'm a home care worker and also a union member. I live in Lakeside down by Coos Bay. I have two questions. The first is, in this new model as it's rolling out, what are the requirements for the agencies to make sure that they are up to a certain level of training for the people that they send out? And the second one is, is there going to be a standardized rate of pay across the whole thing? Because right now, state home care workers are making one thing, and some of the agency workers are making 2 to 3 times more than that. And I'm sorry, but at some point, that is just gonna come back to bite us if we don't fix it. Thank you.
So let me take training and then let me talk about payments right. So the training would be the state through administrative rule and through contract would so right, there's two components there, right? So we have administrative rules that act as kind of the law of the land. And then you have contract requirements that apply to that specific contractor. So through that, we would require specific training. And then there's a bill that passed in 2022. I'm really bad at years, you guys, because I've been doing this a long time. So I think it was 22 that said that all caregivers that are paid by the state for aging and people with disabilities need to have similar training criteria. So we're working on administering that bill and getting it going. And so that would apply to these agency with choices programs as well. On the rates, the way the bill is conceived is the state would pay the agency, and then the agency would then collectively bargain and determine how much they would pay their caregivers. That may result in a different pay amount going to those workers compared to home care workers and personal support workers. But I don't know, because that would be the future.
Well,
I'm
my
confused.
concern is if we don't get these two questions hammered out before we start, then
Gonna
we
have a
are going
mess.
to be in a situation going forward where there's a lot of ambiguity. Nobody knows what the other person is doing. Nobody knows what the other half is doing. And it gets really, really confusing. Plus, I'm sorry, but why should home care workers continue to work through the state if they can go to an agency and make more? There needs to be one amount for everybody, through collective bargaining or whatever, that needs to be established. And also the training needs to be established so that when you are sending somebody into a home where the consumer, for instance, has a trach or uses oxygen or needs wound care, that we know that the person going in has that training or they will not be sent in.
Thank you.
Okay,
I,
Libby? Oh, you have
I'm
more,
just
okay.
not sure that that we have legal authority to mandate a provider pay their employees a certain amount. That's just not something that we have legal authority to do. The training issue, I totally hear you, but the idea of the agency with choice model is to continue to empower the consumer to select and train the individual to meet their needs. So there's no intent to undermine that value that we have in our system, that consumers can self-direct their care. But I agree that training is critical.
Okay, Libby.
Thank you. I'm Libby Batlin with Oregon Healthcare Association. Jane Ellen, you had mentioned on the slide around why is agency choice being proposed, that one of the challenges with the home care worker system today is long wait times for enrollment, and specifically called out the background check process. So I'm curious, under agency with choice, are agency with choice caregivers not going to be subject to the state's background check process? Are they going to be given some other avenue, whether it's private screens or something else? Because I'm struggling to see how the agency with choice model is going to fix the background check wait times that we all, struggle with in any type of setting or provider model.
Yeah, thanks, Libby. Sorry, I need to take a drink real quick.
No problem.
Okay, I'm back. So it's not intended to say that, because we would not allow the agency with choice provider to bypass the state-run background check process. We think that's a critical safety factor, and we've had that discussion with the Oregon Healthcare Association related to in-home care agencies. I think part of the process is the support that someone needs to navigate that process. So right now, there's the application, there's the background check, and then maybe they have to get fingerprints. All of that can be pretty confusing. So I think the intent is that the agency will help somebody navigate that process versus trying to have them do it on their own.
Okay, thank you.
And next, I can't read your name. You're muted.
Shelley McCarthy. Shelley
No.
McCarthy.
No, I've got somebody that's ahead of
Oh,
you,
Okay,
and she's muted.
okay.
Okay, I
There.
think can you hear me now?
Yes, yes.
Okay, thank you. I am Christy Wilson. I'm from Metolius, Oregon, along Madras. I just want to ask about a question about how do you judge a full assist and a not full assist a patient? Because I am on spousal pay, and my case manager, when they come to assess my husband, they said that he's at full assist when my husband has a chronic illness and he is disabled because his knees are shot and he is now in a wheelchair, but he's a wheelchair bound. His hands are crippled. He cannot do anything for himself. And he has, if you let me tell you what are his illness are, he has neuropathy, restless legs, foot ulcers.
I'm going to stop you there because I think you're violating his confidentiality, and
okay.
but in general, in assessment of an individual, we're looking at their functional ability to meet their own needs, and
Yes.
so each of the activities of daily living and instrumental activities of daily living, we're
Mhm.
looking at the tasks that are within those definitions of activities of daily living, as an example, and the frequency. So, and usually, almost always, it's the frequency that drives if somebody is an assist or a full assist. But you can
Okay.
always sit down with the individual's case manager and ask to have a discussion about the care needs for the individual.
Okay, I'm just asking about the time because they only gave me 32 hours. And it is really hard on me for only working for 32 hours when all of us have the same bills. We are paying the same with the same bills with other caregivers. And the only difference is that I am working inside my home taking care of my husband. And he has more illness than the others, and they cannot give me that hours. That's why that is only my only concern. And I've been talking to them, but they said that they cannot give me because my husband is not full assist. And I am almost like an unregistered nurse for taking care of all this illness that my husband and incapabilities that he cannot do for himself. I want to work with other jobs, but I cannot leave home because my husband cannot do inhalers. He cannot do his own oxygen. He cannot do his nebulizers if he needs it. So if he is asking for help from the agency or from DHS, the DHS will pay three caregivers because he's a 24-hour care. But being the spouse, they cannot give me that. They only give me 6 hours and a half for a day, Monday to Friday. So that is only my only concern, and that's what I want to share with you right now. Thank you.
Thank you for sharing.
Okay, Shelley?
Hi, thank you. I have two concerns. Again, if the pay rate is not equalized, it will bring down our union and our strength of our collective bargaining. Because the minute someone hears about an hour difference, they don't care about all of the other factors as far as benefits, health insurances, and all that. So they don't really base it on a full picture a lot of times. And I just see that's part of why we're having some issues now with our private agencies and our union and how it's affecting our union. And so the other concern I have is on these, it just seems like to me that there's a lot like staffing on background checks. It's like that the person that brought up a background, that isn't just about knowing the process. I just went through it recently, and I've talked to a lot of members because I'm a co-director in Coos Curry. And it's also because the state themselves we're having stacked up because they were having staffing ratios. And so I don't see a lot of this being resolved until the state resolves the staffing ratios with their caseworkers and the people that do background checks. Thank you.
Thank you.
Okay, Tina.
I'm not going to get an answer, I guess. Okay.
Oh,
Well, so on the rate of pay, I hear what you're saying, but we do not have legal authority to tell a private entity what they can or cannot pay. That would have to be a separate legislative change that would give us authority to say, you have to pay these providers this amount of money. And so that's where we're kind of stuck. The intent, I mean, this legislation is being proposed and advocated on by SEIU. And so they believe that they can help support home care workers through this new model. And they believe that they will be able to collectively bargain an appropriate rate through that process with this new agency. So that's kind of my understanding of where they're coming from, is they're trying to address a lot of the problems that workers are facing, and they're trying to make sure that this new agency will still be collectively bargained. And then on the issue on workload model and ratios for case managers, we are dependent upon the legislature to fund case manager positions and allow us to serve folks. We're going to be asking in February for additional case managers, because we agree with you that our local offices, especially our case managers, are stretched very thin, and it takes a lot of work to help serve individuals.
Right. And it's all levels of state right now are really in dire straits. And so again, I can see the intent and the concept, but there seems to me like if this isn't carefully slowly put out, that they could run into a lot of issues. Yeah. So, thank you.
hey,
Thank you.
Tina.
Thanks, Ruth. My name is Tina Treasure. I've been a professional and personal advocate for like 48 years now, because I happen to be a wheelchair user. So I'm also a consumer of in-home care. Just hearing about all this, I'm wondering two things. One, I have a comment, but first I have a question. Can people, after we think about this more, submit our comments? And if so, who would we do that to? The second thing I'd like to say is I can't see it now because it was on, I believe, your first slide, but one of the reasons that, you know, you were thinking about going an agency with choice might help the situation of provider shortages right now. My question is, what kind of logic went into that? There will be more providers available if there's an agency now brought into the picture that would be fighting over the same pool of providers we have. To me, it seems like taking the current system that we have and somehow, and I'm not an expert on this, but really beefing up recruitment for providers and showing the benefit of provider careers and things like that would be a much better idea. I'm not saying this isn't needed for other reasons, but I really don't see how this is going to increase that small pool of providers. I just see that pool of providers are now going to be pulled about whether they want to work for, quote, the state or the agency? Thank you.
Thanks, Tina. I think the thought is that we are losing workers because of the payment errors and the delays in payments. And so that the agency with choice will help resolve some of those issues. And then they'll be able to focus on recruitment as well, maybe more intensely than we as a state can. But and on the question of can you send questions in or comments later, please do so. And I'm going to pick on somebody. I'm going to pick on Jenny. Send them to Jenny.
I had a feeling it was going to be me.
Okay.
Well, you can't do rock, paper, scissors on Zoom. So, right, no, we're happy. And Tina, you know how to reach me as well. So feel free to reach out to me if you have additional questions or comments.
Thank you so much.
Joy?
If the system is already bogging down and you're now going to add other areas to it without fixing the bog downs, how is that going to make it better? And one of the reasons that we are hemorrhaging workers is because some of the agencies can offer them 2 to 3 times more. I know that you can't tell an agency or an entity how much to offer, but maybe that part needs to be fixed before we try and implement this. If we need to work with the legislature on it, we can, but we need to fix some of the problems that are already there before we try and do something else. And on the issues of late pay and partial pay, how exactly is that going to be fixed by adding more people to the problem?
I'll try to take that last question first. In the current payment system for home care workers and personal care attendants, the worker enters their hours into the provider time capture system. We then manually take that data and enter it into the old mainframe system. And that's where things are being delayed. That because it's a manual entry process, right? So the worker is manually entering data, and then the workers in our local offices are entering data as well. And I'll be honest that the mainframe system is a very fragile and old system. And it is, things can break in that system as well. So the idea is that these new agency with choice, and what I've seen in other states, is that they have modern IT systems. So the worker enters the hours, they're verified, and the person gets paid, and it's all done in a modern IT system versus the way we're doing it right now. So I do think that the agency with choice will do a better job of making sure people are paid appropriately and on time. I know that we are also working on our provider time capture. I think we're calling it phase 2A. But that will automatically link the information that the providers are entering into the provider time capture system to the mainframe. So we don't have that human error or delays caused by human error. But that will be in July of 2024. The other issue of fix what we're doing. I mean, we are working diligently to try to fix the issues that are causing concerns for workers and consumers. But the proponents of the bill think we need this new model to give people another option to receive the same services that they're receiving or to receive the services that they're eligible for.
Okay, Crystal?
Hi, Crystal DeJarnac, home care worker in Bend and the home care chief steward and bargaining co-chair. My question is, because I'm getting a lot of questions from other members, is this the leeway to phasing out our current program to where we're gonna everything is gonna be done through agencies? And is our program gonna disappear?
Sorry, I couldn't get my computer to unmute there. I don't think that's the intent. What I've heard from the proponents of the bill is they want another option for people and not a total replacement of what we currently have. It's an additional way to support individuals.
So we currently got language in our contract, the new contract, regarding contracting out. How is this going to be any different than what is currently going on? If the workers there are not unionized through SEIU, that would be union busting, basically.
Well, I think the intent in the bill, right? So this is that the agencies that are contracted, so right, we'll do a request for proposal. That's how we find qualified providers or entities. So we will we'll do a request for proposal. We will look and in their proposal back to us, and they will say that they agree to allow their members to become collectively bargained. And then the membership, the staff will have the option of becoming collectively bargained and selecting a union to represent them. And what I'm saying is, from a state perspective, I cannot say, well, this agency has to contract with SEIU, or they have to contract with AFSCME, or I'm going to, anybody out there. That will be up to the members to decide, the staff, the employees of the agency, to decide who they want to represent them.
So in other words, it's not going to change the current system that's happening where they're contracting out. Thank you.
It doesn't change the standard model agency that I think you're discussing around the Office of Developmental Disability Services. This is not intended to address that specifically, that issue. So it's that is a separate model that ODDS has in their delivery system.
No, I'm talking about APD. That's currently happening with APD, because we literally have case managers now who are pushing consumers to agencies.
So
I'm hearing about it from workers and consumers all over the state.
So we have long had in our system, the individual has a choice of all of the different service options that are available to them. So if they choose an in-home program, they can choose the consumer employer service option and then select a home care worker, or they can currently select to receive those services from an in-home care agency. And we have had that for decades. And when I'm looking at the data, I am not seeing a big shift in that, the caseload. Most individuals are still being served by home care workers rather than in-home care agencies.
So Jane Ellen, I'm asking you, because you are at central office, where do we go when we have a case manager who is insisting that our consumer is going to agencies because we are not currently capable of covering all their hours? And so instead of doing partial agency and partial client employed program, they're insisting that the client go completely to agency. This is happening right now.
Or some case managers are even threatening clients, if you don't like it, go to a private agency.
Yeah.
So, Crystal, I hear what you're saying, and I didn't see who was the other person who was spoken spoken
That was
about.
Joy Vager.
Hi, Joy. Sorry. I just couldn't see the whose little light turned on. But the I need to get back to you on where we want those. I want to know about those. I want to follow up with local case management, but I don't want to assign somebody without talking with them first. So we will get you a contact and follow up with you.
Okay, thank you.
Shelley. Shelley, you're muted. I don't know.
Okay, can you hear me now?
Yes.
Yeah. This is Shelley
Um,
McCarthy. Is this the right Shelley? Because I didn't think I had my hand up. McCarthy.
Which Shelley?
What was the last name?
Shelley Adams.
That was
Okay.
you. Yeah.
Okay. Okay, I'm Shelley Adams and I'm in North Lake County. I'm with SCIU 503. And I have a lot of questions, but my main concern is I have spoken with some HCWs who have worked within an agency and come back to the state model because they claim that the agencies basically put you on a roster for a multitude of consumers that you go and you serve for certain periods of time and you're constantly rotating them. So I don't see that as being a workable model for consumer care because they never have the same people coming in all the time. And how is the state going to regulate that? Because they are private agencies. And how would that work in rural Oregon? Because if that becomes the model, we already drive great distances to go to the specific consumers whom we contract with. And if we are now going to be rotated to different consumers all throughout the area, you're talking about huge number of miles, and we don't get paid mileage to take care of our consumers.
So I want to be clear, there is a very distinct difference between the in-home care agencies that wasn't highlighted in the slide versus an agency with choice model. And that the really distinct difference is to very simplistically say it, right? So there's a lot more details, but very simplistically say it is, you're right, an in-home care agency sends people to cover the shifts they've been authorized to cover, right? So this individual is authorized for 100 hours. I'm making that up. And the agency is required to cover all those 100 hours. In an agency with choice model, the consumer is still selecting who they want to provide those 100 hours. So, and then the agency with choice, the way the bill is written, right? This is still a proposal. And again, I'm explaining a bill that was introduced by other individuals, not the department, right? So I'm just trying to explain what people are saying and what is likely going to look like. But in an agency with choice model, the consumer would still choose the person that's providing their care. They would tell the agency instead of the case manager, I want this person to work 50 hours every 2 weeks, and I want this person to work every 50 hours every 2 weeks, and here's my schedule that I want them to work, right? And then if the care provider can't meet those 50 hours, again, I'm making up this example, the agency would be talking with the consumer about who should be providing those missed hours. So it's a little different model than what is a typical in-home, well, it's significantly different. It's kind of a hybrid between an in-home care agency and our current consumer employer program.
Okay, and then the last major question I have is are all the agencies in like the big city areas currently? Because I don't know of any that are in Lake County. So how would they oversee the care workers in our remotest areas of Oregon? Would it be the agencies out of Portland, or would new private agencies be encouraged by the state to come into our counties?
This is very different than an in-home care agency, right? So we would be requesting a new, it's a different model. It's not an in-home care agency. An in-home care agency, as an example, has to be serving people within 60 miles of their office. This is different than that. Because it is still a consumer self-directed program, the consumer is still responsible for a lot of the day-to-day requirements, training, etc. And so what the intent is that there would be two statewide, no more than two statewide agency with choice models. So yes, we would assume that we are contracting with entities that are not currently providing that specific service in Oregon.
Thank you.
I'm going to change the order of things. I'm going to call on Diane because the others have been able to already talk and she's been waiting all this time. So Diane.
Yeah, I'm Diana Evans. I'm a director from here, our local 503. I'm also a personal support worker. I said, so when you're telling me about the agency of choice, I said, so is it going to be something similar to the way they do right now as for like brokerages? Because I know that the brokerages follow the way everybody does, where they still pay the same rate like the state workers do, because that's, you know, I don't know, it's because I guess they're contracted through the state. So I didn't know if because of ODDS and SDS, so they're going to still stay in place to continue doing their portion to make sure that they can get the allotted amount of hours.
Well,
so that
this would not apply.
That way your agency of choice would have an idea about, you know, how many hours the consumer is going to be allotted.
Well, it's this doesn't apply to ODDS consumers or people served in the ODDS system. So it's not a direct linkage to the brokerage, but the idea would be the new agency this agency with choice model, if the consumer selected to receive services through that system, the case manager would authorize the hours to this new agency with choice, and then the agency with choice would work with the consumer about which providers they really want to have provide the services, the actual on-the-ground services.
Okay. Now, because I was just curious if they were going to run the systems similar to that, where they send them out to the brokerages, which I know are contracted to the state, so that they could get the same pay rate as well. Because I know everybody was talking about the pay rate, since I know we get the same pay rate as our home care workers and our PCAs. So
my understanding is that at least to begin with, it's complicated because, again, we can't tell an agency currently under state law what to pay their workers. So, but I don't think there's any intent by the drafters of the legislation and the proponents of the legislation to try to create a system that's out of balance.
So our agencies are still going to be like the main force where, you know, when people ask you how can they get services, so we still send them to the ODHS system so that they can qualify for hours before they can be sent out to these.
So the local office will still determine eligibility and will assess the individual's need and authorize the specific hours. Not the days and times, but you're authorized for, like I said before in my example, 100 hours every 2 weeks.
Mm-hmm. Yeah, because I was trying to figure out who would authorize that 100 hours. I didn't know if it was going
Yep.
to be the agency of choice, or is it still going to be where the state
It's still the
regulates
case manager.
hours that, yeah. So the case
Yeah.
managers do the same. They're still the ones who regulate the hours for the
Yep.
Medicare,
Uh-huh.
Medicare clients.
Will the AWC be doing a huge media campaign to attract people to their services?
I don't know, because we've never worked with them before in Oregon. I would assume that they would be doing work to try to recruit workers. But I also think that a consumer who, as an example, doesn't want to manage all the consumer employer roles and responsibilities may say, hey, Joe, my caregiver, come with me to this agency with choice.
Thank you.
George, you still wanting to ask a question?
Yeah.
Okay, then Joy.
How is this going to affect the PCAs? I'm a home care worker for part of my hours, and I have a PCA for the other part of my hours. And the people that I have taken care of, while there are currently no specific trainings for us, I've been advocating for there to be specific trainings for us, because it's really important that you know how to interact with somebody who's hearing voices so you don't make it worse. And I'm wondering how this system is going to impact the PCAs, because a lot of times we tend to get left out of the equation, and I'd like to make sure we don't get left out of the equation this time.
I hear what you're saying. My understanding is that the bill would specifically apply to the with disabilities. So it would not include personal care attendants at this point. But I'm not sure if that will change through the legislative process.
So you will be siphoning off the pool of workers without any plans to replace them?
I don't think, again, this is not legislation from Aging and People with Disabilities, but I don't think that that is the intent. It is to support the workers and the consumers, not siphon people out.
Okay, thank you.
Tina?
Yes, thanks. One thing really quick to Jane Ellen's last comment. I can see that a lot of the things that are being proposed have one intention, but as we well know, if we haven't yet experienced a new program or whatever, they have unintended consequences that maybe we haven't thought of or can't foresee or whatever, that could make this program even more confusing, have a greater staff shortage than it does, etc. I'll just leave that as a comment. My second question was, who did you say is sponsoring this legislation? And my
During
third,
the 23 session, the legislation was requested by SEIU. In the coming session, 2024, right, everybody? 2024, the bill will be introduced, at least on the House side, by Representative Bowman.
and I guess I'm kind of confused because I've heard a lot of well-spoken SEIU representatives today from different areas of the state who don't seem to either have known about this or, they have great concerns about how it's going to affect the union and things. So that's why I was asking, because I thought I'd heard you say SEIU. And so I'm just wondering if there was consultation among their members or not, and I'll just leave that as a statement. The third thing is I always am a proponent of choice. However, when I can't even remember her name now, wanted to start a union period, she came to talk to me at DHS and said, would you support this, unionizing our home care workers? And I said, independent living, at that time I was the director of the State Independent Living Council, I will go to them and ask for an official position. My personal opinion is I think it's a great thing because providers need someone to assure they get a fair wage and benefits and all those kind of things, because we'll have more qualified people. However, the moment that not just the wages, but the cost of the entire program becomes so large, it affects the number of consumers that can then get services. Because I've lived through that, as Ruth has, and a lot of people on the phone, where, okay, we have to shrink this pot of money because we don't have enough. So we have to go from level 17 to 13, and then we go back to 14 and whatever. So I just can't believe that an agency with choice, as well as like a recent letter I wrote, expressed concern about, so many in-home agencies trying to draw people out of the state program. That's got to cost the state more money because you're paying a middleman. And to me, if there's that much money, then we somehow need to get together to get the legislator to understand you need more help in APD or the background checks or whatever to solve some of these problems in-house in the current system. I think I'll be quiet now, but those are kind of my other comments as I've listened to others. Thanks.
Jane Ellen, we're over time, but we still have one more question.
I can
You
stick
want-
around.
Okay, then go ahead, Patty.
Thanks. Hi, everybody. Patty Falkenstein. One of the groups I'm representing here today is the Governor's Commission on Seniors. And I'm wondering, Jane Ellen, there's in the legislation language, there is 2 opportunities for agencies to start up. And I'm wondering, are there established agencies in other states that are likely to come in and, more or less bid for this business? Or are we looking at startups? I'm just concerned about the timelines and glitches and hiccups. We saw that problem with ORPTC DCI and phase 2 timelines stretching out to infinity. And I just have concerns about that. I'm wondering what's your take on that?
Yeah, I mean, I'm concerned about timeline. I'll be very transparent because it also takes us a lot of time to stand up an internal team to help run this. And then if there's IT changes, could be a problem as well. But there are really successful agency with choice providers in other states. The Washington State, like I said, they've done a massive amount of work because they have a bigger in-home population than we do, and they've moved everybody over. That program, is running. They actually, I can't remember how many states, Patty, they said they serve, but we also have a contract with, so as an example, we have Acumen that is a fiscal intermediary and a supporter for our Independent Choices program for individuals who want additional financial management support. And they have agency with choice models in other states. So what we would need to do is do a competitive procurement. And part of what we would probably be looking at, there's no legislation yet, and I don't have administrative rules, but we would likely be looking at a brand new contractor and we would set those requirements around the expertise that they bring to the table.
Okay, and one more hand popped up, Jane Ellen. So Andrea,
Hi, I just wanted one quick sum up question. I'm just curious if you could tell me in summary what you actually see as the benefits to both the consumer and the care providers of adding this additional choice.
For consumers, I think it takes I think they would feel that they have more support in finding caregivers. They would feel like they have more support when they have concerns about the care that they're receiving. And I think that it would reassure them that their care providers are being paid timely, so that that's not stressing out those caregivers that are so important to them. For caregivers, I think that to me is the number one issue. And I'm not the sole voice here, right? There's a lot of people involved in this discussion. But it to me is making sure that people are paid timely and getting off of our antiquated IT system that really hampers our ability to be nimble and support this workforce.
Okay, thank you.
You're welcome.
okay. Then there's no more questions. So we're going to call this session to a close. And thank you, Jane Ellen.
Thank you, and thank you to SEIE, or to, excuse me, the Oregon Home Care Commission for letting me be here today and talking this through. This is exactly the kind of conversation that APD thinks is really critical, is individuals and consumers and community partners that need to hear about this, and let's talk it through and build something that's going to be good for Oregon and the people we serve.
Okay, and our question from the Home Care Commission is, will you be available, say, next month to help us further talk through this?
For you, Ruth, anything. Yes, I'm
Okay.
happy to come and talk with the Home Care Commission next month.
Okay.
Unless it's on the 25th.
No, it won't be.
Okay. Thank you, you guys. Have a good afternoon. Bye-bye.
Thank you. Okay, for the commissioners, do they have anything more that they want to discuss? Okay, then I will go ahead and close this out. And thank you for being here.